I was 55 when I got diagnosed with triple negative breast cancer. When I told my mom, she immediately cried and she actually blamed herself. And she said, the worst fear I've ever had is passing breast cancer down to you. My mom was 50 when she was diagnosed with stage 0 breast cancer. But she didn't really think about cancer in our family until I got sick. And I said, Mommy, do we have anybody that we know with breast cancer? And then that's when it hit her that her aunt had died of breast cancer. And then I said, well, how did your grandmother die? And she said, a female cancer. And I said, well, what does that mean, Mommy? And she said, well, my mother didn't really talk about it. But that's typical of Black families. We just don't talk about health. And that's because a lot of Black moms or single moms are the breadwinners for their families. And so they don't want to talk about disease and tell people they're sick because they'll make them afraid that they can't take care of them. And we have to get over that. We have to know about who had a disease before us in another generation. It could help save lives and keep people from dying.
So it is critical for patients like Ricky who are diagnosed with breast cancer or who have discovered through genetic testing and they are at risk to be able to have honest and open communication with their family members. And yet, having these types of conversations can be quite daunting. Family members might not be open to discussing hereditary cancer. They may be fearful about the health of their loved one or their own health. There may be cultural factors at play, or they may have different opinions about what someone with a positive diagnosis should do in response to the test result. Hi, I'm Dr. Sara Inés Ramírez. I'm a family medicine physician and a member of the Family Medicine Education Consortium, or FMEC. Thank you so much for joining us the sixth and final lesson in the Family Medicine Education Consortium's Confidence in Hereditary Cancer discussion series. This series was created to encourage family physicians to utilize narrative medicine in recognizing the importance of helping patients identify their potential risk of hereditary breast and ovarian cancer, understand its implications, and take action. In this lesson, as well as the previous one, we are talking about how you can address some common questions and concerns from patients who are dealing with hereditary cancer. Part A covered questions patients may have about insurance, privacy, disclosure, and discrimination. In this video, I'll cover how family physicians can address concerns patients may have about sharing information with their families. I'll also address the question of what to do if a patient is resistant to talking to other family members who are also under your care. What responsibility, if any, do you have to directly inform at-risk relatives about hereditary cancer risk? Throughout this series, we have been emphasizing how family physicians are uniquely positioned to assess a patient's risk of hereditary cancer and how to counsel them through options to evaluate and reduce their risk. Family physicians are uniquely positioned to help patients understand the importance of having transparent conversations about hereditary cancers with their biological family members. The National Cancer Institute offers some interesting insight into who is most likely to disclose their test results with family members. Data suggests that age and gender are important variables. For example, female carriers are more likely than male carriers to disclose their genetic test results. Older women are more likely than younger women to do so, especially to their daughters. And among males, non-carriers were more likely than carriers to tell their sisters and children the results of their tests. When individuals choose not to discuss the results of their genetic tests, the most important reason individuals gave is that they were not close to the relatives or had a poor relationship with them. The National Cancer Institute also noted that although the idea of sharing one's result can be difficult and stressful, disclosure can actually help reduce psychological distress among patients in the long run. So knowing who might and who might not be more open to disclosing their test results and the why can help you anticipate with patients and yours may need additional encouragement and support in informing their family members. Some of your patients may be the first in the family to learn that they have harmful genetic changes that raise the risk of breast, ovarian, or other cancers. This information can affect the health of other family members, both women and men. Since gene changes such as BRCA1 or BRCA2 are passed down from a parent, other people in their family may also have the gene change. So it's important for your patients to share the information they learned from genetic counseling and testing with family members so they too can make decisions for their health. This can put your patient in the challenging position of having to not only share their own test results, which can be very emotional for them, but also warn other family members about their own potential risks. Patients may look to you to guide them through initial conversations with their family members and loved ones. Narrative medicine in the form of patient stories is a valuable tool to help both you and your patients prepare for those important conversations in a broad range of scenarios and responses. Let's take a look at a series of video clips where patients reflect on their experiences of telling family members about their diagnosis.
And they said, oh, you got to get genetically tested. And through that, I found out that I carry the BRCA2 gene. I said, wait a minute, I could give this to my kids.
He called and was trying to explain it. And at that time, I think I was like, I'm 32, I'm young, no problem. But then my doctor, she's like, just to be proactive, let's get a mammogram. And that's when they found my cancer.
So right there, I hit rock bottom. You know, I took it as, wow, I passed this on to my kids already? But she said, Dad, we're gonna beat this. Don't worry about it, we're gonna beat this.
He would go to my chemo treatments, I would go to his.
Yeah. And that's how we got through. We got through.
So as soon as I found out that I had the genetic mutation, I told family members that I was planning on having a preventative double mastectomy, and that was shocking to people. One of my aunts, she's like, that's gonna take away all of your womanhood, and thought that I should just have faith that I wouldn't, get breast cancer. But I kind of decided that I was gonna do this.
In these videos, Arnaldo shares the guilt and devastation he experienced at feeling like he was responsible for passing his disease along to his daughter. Ellie shares how family members were shocked at and even disagreed with the action she decided to take in response to discovering her BRCA1 mutation. Reluctance, anxiety, guilt, fear of disapproval, and the awkwardness of not knowing what to say or how to say it are all potential barriers patients might experience in sharing their news with family members or loved ones. Culture can be another factor that plays a significant role in family conversations about hereditary cancer. Recall Ricky's story from the beginning of this lesson, as she reflected on her experience of being a Black woman with breast cancer. She shared that it's typical for many Black females not to talk about health and especially cancer. As physicians, we need to appreciate that sensitivity to cultural differences is particularly important when communicating and counseling on genetic issues due to the uniquely personal, family, and societal implications of genetic disease. Viewing videos, hearing patient and family stories, and observing their range of emotions can expand our personal perspective, increase empathy and understanding, and prepare us for conversations within our own practice. The video clips we just watched are from the CDC's Bring Your Brave campaign, which is a rich collection of resources and stories about confronting hereditary cancer from the perspectives of patients and providers. We refer you to them throughout this series because they can be an invaluable tool for doctors and patients. The Bring Your Brave campaign has a webpage called Talking About Your Family History of Cancer. It includes links to a conversation simulation called Let's Talk, sharing info about your family cancer risk. The simulation models how to start, navigate, respond to, and handle conversations on hereditary cancer. A virtual coach guides users through a series of discussion paths with a virtual patient and provides users with feedback on maintaining a positive tone and attitude while sharing information, expressing empathy, attending to the patient's emotional reaction, and helping patients decide what actions they can take next. Another resource we've pointed to is Story Center. Story Center's webpage, Conversations About Hereditary Breast and Ovarian Cancer Save Lives, features a suite of short videos by survivors, family members, and healthcare providers. By sharing stories and links from these resources with your patients, you can help them push past feelings of resistance they may be experiencing at the thought of talking with family members. For example, sometimes patients are unable to see past their own fear and anxiety in order to see the benefits of sharing their diagnosis with others. In a situation like this, it may be helpful for you to share a video from the Bring Your Brave campaign called The Positive Effect of Sharing Your BRCA Genetic Test Results with Family Members with them. The video is a truly inspirational account of women taking the difficult step of sharing their diagnosis with family members and the good things that came from doing so. The CDC's Bring Your Brave campaign also includes several videos that contain helpful how-to information, such as tips and advice for how patients can approach conversations with their family members. For example, in What Should I Know About My Family History of Breast Cancer, Dr. Tamika Fairley, a senior health scientist at the CDC, provides some prompts for how people can begin a conversation with relatives about the possibility of hereditary cancer within their family. I encourage you to take the time to view these resources on your own, as well as develop a plan for how to share them with your patients. Some ways to share them could include a note in the after-visit summary that includes links to the Bring Your Brave website and/or specific videos from the campaign, a handout that includes the Bring Your Brave website address and a list of recommended videos, a tablet you keep in the waiting room so patients can watch the videos while they wait, or a tablet you keep in the exam room or consultation room when you can watch selected ones with your patients. Watching stories of the experiences of others can help your patients become more comfortable with the idea of sharing their results with family members and loved ones. These videos can also help your patients prepare what to say to or what to ask relatives. There are also concrete things you, as a provider, should do to make these conversations easier for your patients. One is to confirm exactly what their genetic test is telling them and what their diagnosis is. A second is to discuss which family members should be informed and potentially tested first. Who in the family is most likely to have the same genetic condition and should consider testing, such as sisters, brothers, and parents. Children may also have the genetic condition, but may not need testing for adult onset conditions. A third thing you can do is help your patient think through how they will share the information and what information is most important to share. Perhaps they should start with a close relative and engage them in telling others. Perhaps they will want to write a letter explaining their diagnosis. Perhaps they will want family members to accompany them to a future doctor or genetic counselor visit to hear directly from the health professional. Finally, help your patient anticipate and be prepared for possible reactions. For instance, family members may want to avoid the discussion since they do not want the anxiety of knowing they may be at risk for cancer or other conditions. You can help your patient understand that it's important to respect their family member's decision, but let them know that people like family physicians and genetic counselors are available to talk to them when they are ready. By helping your patients know how to discuss their family history and what to say, we can help them feel more confident and empowered to do so. However, occasionally, even after providing the support, we encounter a patient who remains unwilling to talk to their family members about their test results or diagnosis. And since, as a family medicine providers, we often know and even treat our patients' extended family members, a hereditary cancer diagnosis in this situation is not only your patient's concern, but ours as well. What responsibility, if any, do providers have to directly inform at-risk relatives about hereditary cancer risks? When patients do not inform their at-risk relatives about actionable genetic risks, doctors may face an ethical dilemma about our duty to warn the affected relatives. However, while individuals have the right to decide how to manage their health information, healthcare providers are neither required nor allowed to notify at-risk relatives without a patient's consent. As a physician, it can be distressing if a patient chooses not to share their medical information with their family members who might be at risk. In such cases, we may consider our duty to warn. However, whether to disclose a patient's confidential information or inform their relatives about genetic information is still a topic of debate. If you find yourself in this position and are considering overriding patient confidentiality or consent to directly notify relatives about genetic information, it's important to first consult with an expert. You may have access to an ethicist, an ethics committee, legal counsel, a privacy officer, or other resources within your practice or health system. These can help you adhere to local ethical standards and legal, regulatory, and privacy requirements. So take advantage of these resources before you make any decision to disclose information to those who may be impacted. So let me review some of the key information from this lesson for you. It is critical for patients who are diagnosed with hereditary breast cancer or who have discovered as a result of genetic testing that they are at risk to be able to have honest and open communication with their family members. As a family medicine provider, you play an important role in helping your patients prepare for these conversations. By sharing the resources I've named in this lesson, along with others from the Bring Your Brave campaign or Story Center, you can help patients reach a point where they can feel more comfortable and mentally prepared to have conversations with their family members. Finally, if you find yourself in the difficult situation of caring for a patient who is unwilling to inform their at-risk relatives who are also under your care, be sure to seek ethical and legal counsel before taking action. Thank you so much for joining the Family Medicine Education Consortium to learn about supporting patients' common questions and concerns about hereditary breast cancer discussions with family members. And be sure to check out our additional videos that are part of this Confidence in Hereditary Cancer discussion series. Our aim throughout these lessons has been to equip you with the skills and resources you need in order to assist patients who have discovered they may carry harmful cancer gene from initial discovery to sharing this information with their families. We truly hope this series encourages and inspires you.